You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he said nobody should be wearing a loose-fitting denture. With us, we have New Mexico's go-to implant dentist, Dr. Jacob Rogers. Dr. Rogers, welcome to the program.
Thanks for having me, Randy. Happy to be here.
Good. Now, I know you brought a stack of photos, so we'll try to get to as many of those as possible. Now, for people that don't know your practice, like who's the typical dental implant patient these days?
We don't have a typical patient per se, but for patients that are interested in dental implants, there's two types. Patients that have been wearing a denture, upper and lower, for years and years, and are struggling with that because dentures are horrible.
Okay.
They move around. It's hard to eat with. You have to use adhesive just to keep them in. So they come to us because they want a set of teeth that don't come in and out.
Okay.
Second group are patients that might be headed towards dentures. They're missing some teeth. They have loose teeth. They're dealing with pain day in, day out, can't chew with the teeth that they have, and they don't want dentures. So what we do for those patients, Randy, is that we give them a set of teeth that don't come in and out.
So in New Mexico, are there a lot of people wearing dentures? I mean, is it a big problem?
It's a huge problem. In New Mexico, we have the pit. It's where we play UNM men's and women's basketball, and we like to pack the pit. But in New Mexico, you could fill the pit several times over with patients who are headed towards dentures. And then above and beyond that, Randy, there are tens of thousands of patients that have dentures now that are struggling with them.
So if there's so many people, as you say, wearing an upper lower denture or headed to dentures, why aren't they all coming in to get a new set of teeth with dental implants? What's your take?
Well, I think one of the big reasons that denture wearers don't come in and get this treatment done is that they're out of the system. They've been wearing dentures for 10, 20, 30 years. And anytime they come to the dentist, it's because they have problems with their dentures, they have sore spots, they're not fitting well. And the treatment they get is very limited. They get a reline that they have to pay for, they're not happy about. But nobody's talking to them about dental implants and how to make their life better with dental implants. The second reason is because they're afraid to come to the dentist. They've been through everything in dentistry.
Like the denture wear we're talking about.
Yeah, the denture wear. Before they got dentures, let me paint a picture for you, Randy. So they've been to the dentist, 10, 20, 30 times over a span of 5 to 10 years. They're getting root canals, they're having root canals fail, they're losing teeth, they've got gum infection, and these are big issues. And then finally they get to a point where they're ready to throw in the towel and they end up with dentures. And they're relieved because finally they don't have to go back to the dentist every couple months. And all these experiences, of course, have built up the anxieties and fears.
So the last thing they want to do is go see you.
The last thing they want to do is come see me. I mean,
but you could almost help them the most, right?
Oh, for sure. And we've got so many great options for these patients. And if they could just get in the door that one time, we can help them.
Okay. How old can you be to get this done?
So you can be any age. We do implants on very young individuals if they're missing a tooth congenitally. And we do implants on patients 80, 90. Oldest patient I've done an implant on, 98.
Why would a 98-year-old want to do this?
Because like you and me, they want to eat and chew and smile.
That's fair. Okay.
Yeah.
So it doesn't matter. I mean, statistically, they're not more likely to kind of fall out if you're in your 90s.
No, especially with modern technology, modern implant techniques, we can place implants predictably in a way that will last for any patient regardless of their age.
Now, isn't it true, though, if you've been wearing a denture like 10, 15 years, you can't do this, you don't have enough bone? Like your bone has dissolved away.
A lot of patients have been told that. And maybe 10 years ago, that might have been true for that patient. But we've come so far in the last decade with implants that even patients who have very limited amount of bone can get dental implants done. And the way we do that is with the technology we have.
Okay.
We have 3D x-rays. We can see exactly where the bone is. And then we have ways to make surgical guides with 3D printers where we can put those implants exactly together.
Everything works out. Somebody watching this, they're wearing an upper lower denture, and they're maybe 75, 80, fairly healthy. They can go in tomorrow and maybe have their teeth by the end of the week.
They sure can,
Is
Randy.
that possible?
Oh, definitely.
Okay.
Yeah, and that's what really makes us a little bit different than how most dental practices are approaching cases like this. Our goal is to get their final set of teeth within a few days after we do the initial surgery. And so instead of waiting 6 to 9 months for your final set of teeth, it's a couple days.
So you're big on IV sedation.
Oh yeah, Randy, we do a ton of IV sedation. I love doing it. It's great for the patient. We see a lot of patients that have been out of the system because of their fear. And finally, we can get them into the office and provide treatment comfortably under IV sedation. Sometimes things that would take 6 months worth of appointments, we're getting done in 1 day.
Because of IV sedation.
Because of IV sedation. And it's
And is it true
comfortable.
they have like almost no memories? In some cases, like they forget?
Oh, absolutely. I just had a patient the other day mention that she didn't even realize that she was there that day. And so she had woken up with a brand new smile the next day, or realized she had a brand new smile the next day. And it was fantastic. It's the best dental appointment all these patients have ever had.
How soon can you eat? Okay, so you had no teeth, now you have a brand new set of teeth. How soon?
Right away. You know, they can chomp down on most foods immediately after the surgery once we get those teeth in place.
You tell them to kind of take it easy at the beginning.
Yeah.
But when it's healed up, I mean, what could they eat? Whatever?
When everything's healed up, there's no restrictions. One patient, great guy, loves steak, of course, hasn't eaten a steak in decades. Once we got his teeth finished, he just told me on his birthday the other day, he had his first filet mignon in 20 years.
Nice. Yeah. So chewing, because denture wearers, I guess they can't really chew things.
Yeah.
But I know denture wearers, and they never complain.
Yeah, they're not complaining to you.
Okay.
You can't do anything about it.
Right,
you know?
okay, that's
but
fair.
Every day we have patients complain about their dentures. And dentures, we've been doing them the same way for hundreds of years. It's an archaic technology. But with dental implants, they're finally modern. We can give people teeth that work. And
now we're going to get to those photos in a second, but what if you have bad gums, like gum disease? Can you get implants for those people with bleeding gums, the bad breath, the loose teeth?
those are our typical patients. Patients that have teeth now have gum disease, periodontal disease, loose teeth. And we can give those patients a brand new set of teeth. We clean up the gum tissue, get those implants in, and yeah, there's no restrictions on that.
So the gum infection is what, living on the bad teeth?
Yeah. And
So when you remove them, what happens?
So that gum infection is, it's a chronic infection. It's a low-grade infection that the body is continually having to fight.
Okay.
Once those are out, once the teeth are out, which are really what's holding that infection in place, things bounce back like that.
So nice, healthy gums again.
Nice, healthy gums again.
Now, what about their breath
So
from the gum disease?
big one, so bad breath comes from a lot of different things, but the biggest thing is bacteria embedded in your gum tissue. Once we get those teeth out, get the bacteria out of that gum tissue, bad breath goes away.
Okay, good. Now you say this changes people's lives, and you brought photos. So what are we looking at?
Yeah, so let me show you this one. So Dave comes to us, and he's got some issues, of course. He thinks he's headed towards dentures. So wait until I show you the after for this.
Okay.
This is great. So Dave comes in. He's got 3 things he's concerned about. 1, he's not happy with how things look. He's missing some teeth in the back.
Is that him smiling?
That's him smiling, and that's a forced smile. So when you're not comfortable with your smile, in order to get a good picture of your smile, we kind of have to force you, because you're so used to hiding it. You don't want to show that bad smile. And in Dave's case, what he would term, these are his words, his billy goat smile, because he was missing so many teeth on the lower. He was concerned about that. He couldn't eat because he didn't have enough teeth in the back to chew anything besides noodles and protein shakes. And he was deathly afraid of the dentist.
Okay.
And so when we got Dave in the office, I knew that we were going to change his life.
Okay.
Because I could see where we were going to go with him. So for him, options were dentures. And he didn't want that. We didn't want that for him. So we gave him a brand new set of teeth, upper and lower, fixed in place. And you can see the results, Randy.
Looks good.
Yeah, it looks great.
Well, they look like real teeth, actually.
They do. And for him, he made it clear he wanted his Hollywood smile. So,
Okay.
so They look great. You can see how the teeth follow his lip line.
Yeah, they kind of perfectly fit his mouth.
Perfectly.
That's all by design.
By design. And
Computer driven? I mean, is that how you're doing it?
computer driven, and of course, he gets a say in it too.
Okay.
Making sure that it looks the way that he sees himself looking. And now he can smile without holding back. I'm sure it annoys his family, close ones, coworkers.
Always smiling all
Always
over the place.
smiling. Yeah, can't help it.
When he sees his teeth for the first time, what's that like?
Oh, it's incredible. One of my favorite things to watch is someone seeing their new smile for the first time, because you can see how much emotion goes into it, because it changes everything about your appearance. Everything. He looks younger.
That's true. Okay.
More sophisticated,
Yeah.
happier, more approachable. A smile is the center of who we are. People like this, I got to tell you, they can eat whatever they want.
Okay.
There's no restrictions.
Do they ever worry because they've gone so long without eating? They say, "Doc, are you sure I'm ready? I could eat a steak, or I could eat." Could they
Yeah.
could they eat things like raw broccoli or like a carrot with their front teeth, or they have to be careful?
Oh, no, they can. Raw broccoli, carrots. But yeah, some patients are so used to their certain diet that they're really hesitant to start adding those crunchier, harder foods, veggies, salads, steaks, nuts. And so sometimes we have to coach them a little bit so that we can let them know that, yeah, it's okay to have that broccoli now, or it's okay to take
So
that
you can eat
steak.
whatever you want, just like you would with your regular teeth. Like you don't want them to chew ice and things like that, but they could if they wanted to.
Yeah, they could if they wanted to, but of course we want those teeth to last forever, and so you shouldn't be chewing ice with your natural teeth anyway. But ribs, corn on the cob, yeah, anything you can think of, Randy. So here's another one. This is Maria. Maria had been struggling for a long time with loose teeth. So over time, she's lost bone, gum tissue, her teeth were getting loose. She couldn't eat anything with any sort of crunch to it or anything that was solid at all.
Why are her teeth loose?
As she's
Like what makes teeth loose?
gum and bone disease erodes the gum and bone
Okay,
around the
okay.
teeth, and then they start to loosen up. And with that, comes pain, bad breath, and things like that. And Maria's been struggling with that for years. When she came in, what she was feeling is that her smile was changing who she was. She said she went from a happy, social, laughed all the time type person to someone who was much more held back,
Okay.
less confident, low self-esteem, because she was worried about smiling. She was worried about going out with friends and eating because she couldn't eat anything on the menu. And then for Maria,
So was she also headed for dentures?
she was headed for dentures, no doubt.
Okay.
She was already missing a lot of teeth, and the teeth that she had were not long term for her. So she was headed for dentures, and she thought that was her only option. It was denture time.
Okay.
And so she came to see us. We said, Maria, there's other options here. We can give you a brand new smile that doesn't come in and out. And that's what we did, and I think
Very
the results
nice.
speak for themselves. But look at the difference. Now, in my opinion, she's not there yet. This is taken. This
What do you mean
picture's
not there
taken.
yet?
She is still holding back with her smile.
Okay.
These things get so ingrained subconsciously, where you're used to hiding your teeth, that when you finally don't have to, you have to learn how to smile again. And so it's going to change over time. Now, what's great with Maria is when you interact with her, it's different.
Okay.
When she's laughing and talking, she just lets go. That smile opens up.
So you say their personality changes oftentimes.
Yeah, and maybe it's not so much that personality changes, but all of a sudden their smile matches their personality.
Okay.
And so now they just feel like themselves. So how they feel as a person internally is now expressed externally.
When they look at their teeth for the first time, do they ever get choked up, cry? Or their loved ones come in and see them and they get choked up?
Oh, all the time. We see men and women, of course, and women are a little bit different. They're a little bit more open about how their smiles change them. Men, of course, are a little bit reserved. A lot of men don't want to admit that their smile looks better, but their wives always do. Their girlfriends always mention. They say,
Okay.
"Hey, he's changed since he's gotten that new smile." And
What do they like more? What they can eat or the way it looks?
well, I think patients come in with they either want the smile or they want to eat. And the truth is, someone comes in and they can't eat, and all they want is to be able to chew that steak. They get those teeth that they can use to eat whatever they want. And then as a bonus, they now have a smile that they're thrilled with. And now after that 20th compliment, now they forget about how awesome it is that they can chew what they want.
Okay.
Now it's all about their smile.
So they're flashing their smile all over social media, things like that.
Social media, selfies, we got to get those smiles selfie ready.
Okay.
And so now other patients who just want things to look better, they come in, they want the smile that doesn't hold them back.
Okay.
And so we give that to them. And then of course, all of a sudden they can now eat what they want to eat. They get healthier.
Interesting, okay.
They don't have to hold back when they go out to restaurants with their friends. Patients that are struggling with loose teeth and pain and discomfort, when they look at a menu, it creates anxiety because...
Is that right? That's what they tell you?
Oh, all the time. Because you look at a menu, if you can't eat 3/4 of the things on the menu, what can you eat? It's soup. It's mashed potatoes.
Okay.
It's, a drink. And so these patients, all of a sudden they go from, I can only eat this to I can eat everything
on the
here.
menu.
Anything.
So it's a big deal.
A big deal.
We're going to take a quick break. We come back, more about the dental implant process, and I got to get to more of those photos. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back.
My name is Lorinda, and I'm a patient here at Desert Ridge Dental. Well, my teeth had been going bad over the years. I had a couple of implants. They were fine. And then after my husband passed away, I started just not taking care of myself. So after that, they started going really bad. I mean, they were awful. I had enough, so I decided I needed to do something about it. And I looked online to find the best one in my area, and Desert Ridge popped up as 5 out of 5 stars. Initially, I had an abscess tooth removed, and we went from there right away. I said I wanted to do the full mouth restoration. After that, we started planning, and it just went fast. Initially, when I started thinking about my options for me, what was best for me, I looked at the dentures, I looked at bridges. I didn't like what you had to go through to get to that little smile you feel comfortable with. I chose the implants, and I love them. I don't have to take them in and out at night. I don't have to worry about them at all. I can eat what I want to eat. The pain is minimal, and I'm just happy with the results I have right now. What I would say to a person that's trying to figure out what's best for them, if they're worried about the dentures falling out, if they're worried about they're too young for dentures, I would recommend them to Desert Ridge. You feel like family here when you walk in the door. In my opinion, it's the best decision, and this is the place to be.
My name is Rosie, and I'm a patient here at Desert Ridge Dental. Well, I woke up one morning and my front tooth broke off. And so I knew Kat, obviously, and so I rang her and said, "Can I need help?" So she made an appointment. I came down and saw Dr. Rogers, and he told me that, bad news, you need the top all out. So for the next 18 months, we went through that. He removed all my top teeth. I wore dentures. I didn't cope with the dentures. I used to gag. I was one of those people, I was terrified of dentists, as most people are, but Dr. Rogers is just amazing. His staff, his nurses and techs are just wonderful too. So, but yeah, I smile a lot more. I can eat apples and I can eat steak, and I can promise you the dentists and the staff here would never judge you. They are wonderful people, totally non-judgmental. And I've been to dentists in the past who have judged me. So I'm very impressed with the fact that they don't. Yeah.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic is no more dentures, alternatives to dentures. According to my first guest, he says nobody should be wearing dentures. They could have a new set of teeth supported by dental implants. With us, we have New Mexico's go-to implant dentist, Dr. Jacob Rogers. Dr. Rogers, welcome back.
Thank you.
I know you have more photos, so what are we looking at?
Yeah, so This is Al. This is one of those patients that I mentioned earlier that all he was interested in was having teeth that he could chew with.
Okay.
So he had been struggling with sensitivity, hot and cold, sensitivity to sweets. His options for what he could eat was quickly diminishing because he had very advanced gum and bone disease. And his big thing was he didn't want to have to deal with that anymore. He wanted a set of teeth that didn't have any pain, discomfort, sensitivity. Now, Al had been working for years trying to resolve some of these issues. But as we know, a lot of times some of these are just too far gone to really get back to health. And so he came to us, he wanted a different solution. So
he would have been in dentures.
Oh, no question. He would have been in dentures, which probably should have been in dentures, maybe even earlier.
Okay. But not in your practice.
Not in my practice. No.
So what did you
no
do
dentures. Yeah, we don't want to give people dentures. Like I said, they are the worst thing ever. And so we gave him a fixed set of teeth, a new smile, upper and lower, don't come in and out. He said very little discomfort. I spoke to him just recently, and we do IV sedation, as I mentioned, and he said, yeah, I don't remember anything about the procedure itself.
I guess
and
that's good.
And he was surprised at how little pain and discomfort he had afterwards. He owns a very successful business, and he's a busy guy. One of the biggest concerns was how this was going to affect his downtime. How long would we have to be away from his business? And for Al, it was minimal because, like I said, we can do a lot of the work before we actually do the procedure. And then when we do the procedure, it's just a few days of healing, and then we have your permanent set of teeth ready to go.
Nice.
And so the downtime is super low, and discomfort is really low as well. And with Al, I mean, you can see his smile change.
Yeah.
But now he doesn't have to hold back what he eats. You know, he can eat the cold, and he can eat hot, and he can eat sweet things. And then, of course, the added benefit, he's got a smile that he's not afraid to show off. And, of course, his wife loves it, probably more than him.
Now, we should mention, like Medicaid, Medicare, and even the best dental insurance doesn't cover, I mean, Medicare doesn't cover it at all, really. Mm-hmm. And great dental insurance only covers a small portion. But you say people finance this all the time.
All the time. I have very few patients that are able to pay for this type of procedure up front. And so most patients finance. And
you have to have decent credit, right? You're not carrying the loan?
Yeah, we use third-party financiers to make it work for patients within their budget. But ultimately, in most cases, it's less than a car payment per month to get this work done. And we know that's a big challenge for a lot of patients, but we make it as easy as we can.
Now, we are short on time, so maybe we have time for one more.
Yeah. Can I show you one more? Is that all right? Yeah. So this is Lorinda. Like I said, these are basically all my favorite people. So Lorinda, it's almost always the same story. So she's missing teeth in the back. She's got teeth that aren't working. She can't eat anything that she wants to eat. And she's been dealing with tooth issue after tooth issue after tooth issue for years and years. And she thought that her next step was dentures. And so, of course, in our practice, what do I say, Randy?
No more dentures.
No more dentures. Okay. So for Lorinda, we gave her a fixed set of teeth, a new smile, doesn't come in and out.
That's a beautiful smile.
Oh, it's great. And you can see it when you talk to her, how it's changed her personality. She's thrilled with it. She can eat what she wants to eat, and she doesn't have to hold back. Just one more, Randy.
Okay, one
Can you
more.
do that? All right.
Got about a minute left.
So this is Randy. He finally came in because he finally had problems with his front teeth, so he knew it was time. He thought he was going to dentures. No question, of course, no more dentures in our practice. So we gave him a new set of teeth using implants.
Wow, look at the after. So these are people that is maintenance. I mean, now they just maintain them like regular teeth, like every 6 months, go in for a cleaning. Is that how it works?
Yeah, when we make that easy in our practice, they can come in and get their routine maintenance. A lot of places you have to go somewhere else to maintain these. But yeah, they take care of them just like their normal natural teeth, brush, floss underneath, and then every 6 months we clean it up for them.
So do people like this ever come, like husband and wives come in to do this together?
Oh yeah, all the time.
Like one goes first and then the second one?
Yeah, one gets to be the guinea pig and then the other kind of follows on shortly after. Similar. I had a husband and wife that came in. Both had dentures. Neither of them knew that the other had dentures.
Really?
Yeah, and this is the life of a lot of denture wearers. You don't want people to know that you have a denture. And so they did everything they could over the last 20 years to hide their denture from each other. And they both came in with similar issues. They hated their dentures, gave them a new set of teeth. And now they know what's going on in each other's
So now
mouths.
they can go on cruises or whatever they want to do and eat and whatever they want.
Yeah, and their denture's not going to fall out when they're, sailing in the wind.
Now, people with bad teeth, we've had this discussion. You say they are judged. Elaborate on that.
Yes, all the time. And you can just look at modern movies. If you want to make somebody look poor or like a street person, you give them a bad looking set of teeth.
Good point.
But not my practice. So now these people are taking care of their teeth, Randy. They're doing a great job, probably better than you and I. But sometimes that gum infection has gotten so bad that there's not a lot they can do about it.
Okay.
And so in our practice, we deal with that. We give them a set of teeth that they don't have to worry about showing off to the world.
So you say it's a big boost to their self-esteem.
Huge.
Like sometimes you don't even recognize the patients.
Huge, yeah.
Months later.
Months later, you start seeing their smile pop up on social media. It's like it's a different person. And they're not holding back. They're smiling with abandon. They're not afraid to laugh. If you have dentures, Randy, if you laugh too hard, they're falling out.
Yeah, it's
But
terrible.
not these patients.
Good. Now, final message. Somebody watching this, either they're of the two categories, they have bleeding gums, bad breath, loose teeth, maybe they're headed for dentures. Then the other group, the denture wearers, they've heard what you had to say here today, but they're skeptical or they're afraid. What do you say to them?
I invite them in. Just get them in the door where we can do a free in-office consultation. And I'll tell you, Randy, one thing that's been a big help for these patients is we do offer virtual consultations.
So you're online meeting the patients, talking to the patients.
Yes.
Okay.
Yes. So if they're interested and they're worried or apprehensive about just coming into the office, they can reach out online, send me a picture of their smile, and I'll give them a personal video about what their situation is. We'll talk about what options are, and we're going to talk about costs too.
You even talk about financing and costs and all that on these virtual consults.
Oh yeah.
So they just go to your website, they sign up for that.
Yep. Yeah.
Or they could just call and make an appointment.
Yep. And whichever works for these patients, we just want to get the information to them. And I found that the biggest questions they have is they want to know what can they do and how much it's going to cost. And so virtual consultation makes it really easy for us to go over those things.
Okay, great. I want to thank you for coming on the show. Great stuff, great photos. We didn't get to all of them, but these are on your website. Is that correct?
They sure are. So
Okay.
yeah, come check it out.
All right, thanks again.
Yeah, thank you.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.